Hello, my name is Grace Solomon, and this is my second submission, which is a resubmission for my Unit 18 assignment, Earth Promotion. What does health promotion mean? A public health strategy called Earth Promotion aims to encourage people to have better, more active lifestyles. Moreover, health promotion can help people learn how to prevent diseases and risk. Health promotion appears to be very advantageous because there are many safety precautions and diseases that may be prevented, or the risk of contracting certain disease can be lowered with the proper preparation. Health promotion tactics and goals vary across England, Wales, Scotland, and Northern Ireland. But the primary premise and focus is on encouraging healthy habits and people taking responsibility for their own well-being. Health promotion can also be a very effective technique in reducing the strain on the NHS. Many people will use the NHS for health diseases that they can cure themselves by resting or purchasing over-the-counter medications from a pharmacy. The yearly flu campaign in England encouraged individuals to get the flu vaccine, which decreased the number of persons hospitalized with flu. Mental health. Since 1 in 4 persons experience some form of mental illness, health promotion can help reduce stigma and increase public understanding of the issue. Diet, exercise, and obesity. Type 2 diabetes is strongly connected to poor nutrition and inactivity, and obesity is on the rise in the UK. Health promotion can motivate people to make healthy lifestyle choice. HIV or AIDS and sexual health in the UK. There are over 105,000 people living with HIV and AIDS, and STI cases were rising. Younger men and women make up the bulk of STI victims. With the help of health promotion, people can be urged to be tested every 6 months and get crucial information on safe sex activity and contraceptives. Change for Life was a health promotion initiative led by Public Health England that departed in 2009. It was the first nationwide social marketing initiative aimed at combating obesity and the health problem it generates. The Change for Life program was stated to combat kids' obesity rate and to encourage families to live healthier lifestyle because these rates were rising at alarming rates. The demographics of this campaign were for children aged 5 to 11, with a focus on families whose parenting ideas, attitudes, and behavior suggested that their children were more likely to become obese. The campaign's original goal was to prevent childhood obesity. The campaign was divided into four key phases. 1. Alerts. Inform families about the risks of consuming too much sugar and personalize the message to make it more pertinent to them. 2. Promote. Employ parents to take control of their child's food. 3. Help. In the bigger Change for Life campaign, which offers families free assistance, encouraging them to download the recently released Sugar Smart app. 4. Maintain. Make sure kids consume fewer sugary food and beverages, particularly at breakfast, and less sugar in sugary drink, as they are the two key contributors to children high sugar intake. Change for Life connects with children and parents and motivate them to adopt healthy living habits using mass media, targeted advertising, sugar media, school engagement, and mobile apps. This campaign branding concept and color scheme were choosing to appeal to both children and adults. They were all very user-friendly. The majority of society responded favorably to Change for Life campaign because of its activism for promoting a healthy lifestyle and its desire to combat childhood obesity. The Change for Life campaign attracted more than 400,000 families in its first year. Change for Life achieved its predem- pre- predetermined goals by reaching almost 99% of the targeted household. In the first 12 months, Change for Life attracted 400 and 413,000 to 406 430,000 413,000 to 400 413,000 first 466 families. Sorry about that. After 6 months, it was estimated that over 44,833 families were still actively working with Change for Life. In the first year, there were over 1.9 million responses, posted online, in person, and telephone. Change for Life impacts both a separate program for adults in their 40s and new resource for adults with very young children were launched for Stage for Life in January 2010 and February 2010. Respectfully, the first campaign success allowed Change for Life to grow and offer services to additional society segments. Almost 1.9 million comments to the campaign were received, exceeding the involvement goals for society as a whole. The campaign was obviously a success because it was being utilized by numerous households and because it was able to advertise itself as well as gather information and outcome. As a result of the intensive television coverage and social media coverage, as well as over 6.6 million people downloaded the Change for Life app, the finding demonstrated how individuals, particularly children and families, benefited favorably from this campaign. 74% mom expressed increasing concern over their child sugar consumption. 3 out of 10 mothers said they limited the amount of sugar their child would consume. 8 out of 10 users use the campaign linked app on a regular basis, scanning specific food products. Increased obesity, particularly in children, has been linked to excessive sugar consumption. These figures, which are connected to specific families, demonstrate that many parents were concerned about the amount of sugar their kids were ingesting and that some families reduced their kids' sugar intake. Health promotion activity. In 2020, Public Health England began a new campaign focused on better health. The goal of this campaign was to urge adults to make healthier lifestyle decisions for their health by quitting smoking, losing weight, and engaging in more physical activities. This campaign began during the COVID-19 pandemic because research indicated that obese people were more likely than people with a healthy BMI to contract COVID-19 seriously, required hospitalization, or even be admitted to the intensive care units. The Better Health campaign motto was "Let's do it," as you can see in the image I attached. As the campaign was introduced during COVID-19, it was intended to motivate people who were inactive as a result of the lockdown that accompanied the UK initial announcement of COVID-19. The campaign had 4 major objectives: reduce weight, as obesity rates increased and serious hospitalization due to COVID-19 were on the rise due to underlying medical disorder, including type 2 diabetics. Adults were urged to reduce their body weight if they were considered overweight or obese. The Quit Smoking campaign aimed to get people to stop using tobacco. According to statistics published by Better Health, persons who successfully abstain from smoking for 28 days are 5 times more likely to continue their abstinence. Get active. Adults were eat to exercise daily and finish the couch to 5K or adult or active 10 challenge. Drink less, encouraging people to limit the amount of quantity of alcohol they consume in addition to creating a drink spending plan to prevent binge drinking with friends and family in public places. Four apps were employed by Better App to motivate and assist users in achieving their health objective, which are apps for the NHS weight loss, app for the NHS for drink-free days, the Couch to 5K app, the NHS Stop Smoking app, together with employing social media advertising. The NHS website also publishes data and accompanying documentation for anyone to read. However, it was incredibly successful and many other organizations including Age UK and the British Art Foundation supported and shared this campaign on their platforms. Data from the Better Health campaign. In January, 43% of people reported feeling more inspired to make lifestyle change for their health. 6 million adults between the age of 40 and 60 stated they intended to eat more healthy. 39% of adults declared they would reduce their weights. The regular smokers, 4 in 10 people, intended to stop. Due to the campaign success and high level of participation in 2020, it was relaunched in July 2021 to further encourage people, particularly middle-aged adults, to adhere to its 4 main objectives. Public Health England has identified 6 benefits from this campaign that are specific to individuals as a result of the increased exposure and awareness of this campaign through social media, radio, and more than 2 million people who have downloaded the campaign-related apps. A lower risk of prevalent cancer such as pancreatic and liver cancer, reduced chance of blood elevation, lower risk of heart disease, diabetic risk is lower, less stress from persistent joint and back pain, lower likelihood of major hospitalization because of COVID-19. Through the 4 common goals of losing weight, becoming more active, quitting smoking, and drinking less alcohol, people have been able to reduce other serious medical conditions and illnesses in addition to lowering their risk of serious hospital admission and not requiring intensive care unit support due to COVID-19. It starts with the art in the name of the health promotion campaign. Health promotion campaign aims to increase public knowledge of heart and circulation condition and to motivate people to adjust their lifestyle to lower their chance of developing specific condition. Selecting a resource for health promotion campaign, I selected a screenshot of an Instagram post that can be shared through advertising on the website, which is the image below. As you can see, the image right here, which says how to get your body and mind balance to improve your well-being. Underneath is called behavior realization, exercise, and nutrition. The fact that 7.6 million people in the UK have heart or circulatory related disease should be taken into account when deciding how to promote this area of health promotion, because doing so in smaller groups in the neighborhood would not be sufficient to raise awareness of the risks associated with this condition. In order to reach a large number of people who are gathering but do not belong to a particular group, I have selected the max approach. The max strategy, such as national or local approach, can disseminate and exchange this information on a mass basis. This type of promotion has the advantage of not applying to every individual who sees and hears about it, which can lessen the impact it has on people's health. TV, radio, newspaper, and social media are some of the channel this kind of information can be transmitted from. Mass media is typically distributed to reach a huge number of people very fast. Depending on how it will be distributed and subject matters of the health promotion campaign, many resources might be utilized. I will use the information resources for my campaign to promote health. Platform on social medias, posters and narrative highlights, GP office and NHS trust will be published paper poster, advertisement on buses and in major urban location. Additionally, I will promote and advertise my health promotion using these resources. The media I will use is social media as well as actual billboard and poster. My main option of media is going to be a single poster which can be seen as both via social media platforms as well as physically in GP office and also on billboard and posters. As the focus of this health promotion is rising awareness, it also serves to motivate people to make positive change in their own lives, like quitting smoking and drinking less alcohol. The beginning of the new year will therefore be the ideal moment to launch this health promotion campaign. The health promotion effort should go longer than usual because it's crucial to emphasize the significance of heart and circulatory disorders, as well as the risk factors associated with them. The duration should be approximately 6 months long and terminate in June of that year. The ecologic model theory will be used to examine the health promotion activity. The fundamental tenet is to examine influence at different levels, including interpersonal, biological, and physiological. Physiological. The ecology offers a whole framework for comprehending factors in health behavior. The ecologic model several variables include the following: individual or interpersonal factors, which are people hold various of attitude and viewpoints towards illness and disease. In fact, many people are raised in cultures where they may consume excessive amounts of high cholesterol food that can be problematic. Interpersonal factor, this is typically for those around us to hold different options or to hold different opinions. Sometimes these opinions can be beneficial, but they can also lead to misunderstanding and obstacle when it comes to promoting health and leading healthy lives. Organization factors. A person's lifestyle can be influenced by the rules, laws, and policies that affect and have an impact on healthy living. An individual is more inclined to purchase inexpensive processed food than healthy food that could benefit their body and heart if they are unemployed, receiving welfare, and living in poverty. This will be considered a problem and cause of organization. Common factors. A number of groups and communities each have their own policy and perspectives which might have advanced impact on a person. People can be persuaded by incorrect beliefs by those who promote information or who lack a thorough understanding of the dangers of heart and circulation disorder and their primary causes. Public policy factors are laws and regulations that forbid use of early detection and treatment of heart and circulatory illness. As a result, promotion can only be viewed as the advertisement at times, and it is less effective overall because of the prevention method that public policy factor use. This model is useful since it may examine number of different factors that have an impact on a person's well-being. Determine the outcome and success may rely on the scope of the health promotion and the resource employed. An evaluation will be useful method of determining how well these health promotion activities worked. Prior to the release of the health promotion, the evaluation must be written out and selected. It could then be referred to again following the start and conclusion of promotion health activities. Thank you.